Thanks, everybody. Good afternoon. We'll go through some data. There's some positive trends, obviously. The grim reality, though, that we're in the midst of the pandemic and the loss of life continues. We have lost 8 more residents over the last 24 hours. We've now lost 373 residents of Onondaga County to the pandemic, 52 since last Monday. So I think that's just important that we realize that this has been a tough few weeks, horrible month, and certainly the timing of this is horrible with the holidays for these families. We lost an African-American male in his 60s, 2 Caucasian females in their 90s, a Caucasian female in their 70s, and 4 residents of nursing homes have been updated by the New York State Department of Health. Certainly, we just want to think about their families, and thoughts and prayers are with them during the holidays. The positivity rate continues to drop, 6%. Things from a positivity rate standpoint are trending in the right direction right now. It's important in the pandemic we find our balance. As painful as part of it always is, we need to be honest with the data, no matter what the data tells us. And some people suggest that when the data is good, you don't want to highlight it too much because that may mean people will think it's gone. But I think that when you have positive trends, you need to give people the data to reinforce that the efforts they're taking are working. And that's important, that we find our balance. So positive rate about a week, 10 days ago was about 7. We're down to about 6. Again, we need to get much lower, and we have the ability to get lower, but heading in the right direction. From a hospitalization standpoint, overall the data is good today. 327 individuals in the hospital for COVID, that's down 6. 1,238 individuals in the hospital total, that's down 16. 53 individuals in the ICU, that's down 4. Total ICU beds are 152, that's down 17. So essentially our COVID data went down a little bit, but what's more important when we look at hospital capacity is the overall hospital picture, and certainly had a good 24 hours with people, with capacity going in the right direction. Looking at cases, 246 new cases, 17,881 cases since the pandemic began. We have 3,794 active cases. Demographic-wise, 9,577 females, 8,171 males, 2,779 under 19 and 19, 3,642 cases in their 20s, 2,612 cases in their 30s, 2,158 in their 40s, 2,498 in their 50s, 1,920 in their 60s, 1,094 in their 70s, 738 in the 80s, and 440 in the 90s. We have a busy testing week. As we know, people are very anxious to get tested before the holidays. So a reminder on testing, what we have, where we have it. Symptomatic testing, again, we have at the F-Shed through, well, not Friday, right? There's no F-Shed Friday, but through tomorrow. I don't know if appointments are available for tomorrow or not, but ongov.net/Cayuga Medical. Weekend testing at Essentia Health on West Genesee Street, 1050. Again, that's going to be open Saturday and Sunday from 8 a.m. to noon. So if you get symptoms Thursday or Friday, go online, register for Essentia Health. Again, that's ongov.net/Cayuga Medical. Asymptomatic testing this week. We've been out in the community. We'll do over 3,000 tests probably today in the community with all of our sites and here at the On Center. So an amazing amount of community-based testing being done. Again, the strategy being for us to turn this around and stay in front of this virus when it was surging is you need to identify it, you got to find it. That means you got to go out in the community. You just don't wait for it to come to you with sick people. Once you identify it, you got to quickly isolate it. When we went through the surge, we were backed up. We know that we need to identify cases within 24 hours. Again, what did we do? We brought on, trained more people, 225 people dedicated to investigations. And so our investigations are caught up, getting ready for what may be to come. And if we don't have surge scenarios in the future, because everybody is very good for Christmas and Christmas Eve and the day after, and everybody has small gatherings in their pods, we shouldn't see a surge. But we've beefed up for it, and then if we don't see the surge, we can move some of those people to the vaccine teams that will be necessary throughout the community. But again, we had over 11 locations this week in the community. We'll do well over 7,000 tests Monday through Thursday. A lot of people talking about the vaccine, just to give clarity. We're getting a lot of emails about when this is what I do or this is what my spouse does, and I have an aunt or an uncle or mom or dad who's over 75. The state of New York determines eligibility in the phases, right? CDC gives guidance. The state then determines if they take that guidance, and then the state then gets the vaccines from the federal government, and then the state through their hubs says to the hubs, go vaccinate this class of individuals. Go vaccinate your emergency management workers. Go vaccinate your frontline doctors. And then from these phases that they roll out in, it's going to get much more complicated, each phase. And so that's when a lot of the planning that's going on now and the operations and the communications to the public will happen. So right now, we've seen, and the media has reported well, many of our frontline workers in hospitals throughout the central region have been vaccinated. Our nursing homes, which is a separate program with the federal government partnered for long-term care facilities with some of the pharmacies, and then they've set a schedule, and some of the schedules have happened, some of our larger nursing homes, and some will continue to happen through the next 2 weeks. But those are happening now. So right now we've had a lot of frontline hospital workers throughout the region vaccinated. We've now had nursing home residents and employees vaccinated. That will continue. There still may be some frontline medical workers. Your next phase is your emergency management personnel. Think of your ambulance providers. Think of your firefighters and everybody who has direct interaction with the virus potentially. That's going to start, and there's other classifications that the governor put out. So that's how this will work, is the state will determine the classifications. That's the who. The when is when the vaccines come in, and as they come in, you'll have availability. And then the how is what everybody's working on right now. And again, at the county level, we've done a lot of planning. We do planning every year for vaccination distribution. In the event you have a pandemic, we actually have these plans. So we're working on giving this information up through the hub channel, and so that the how will be hopefully what we've been working through. And that way we can, when we get mass quantities of the vaccine, that we can get it done and get it done quickly. So that's a little bit about the vaccine. Positive news, you saw some of our facilities, our nursing homes getting vaccinated, some of our larger ones, some of our smaller ones, our frontline workers. I know today there's other classes of professionals that are getting vaccinated. This is all great news. So that's good. Last week, just something wanted to highlight. We talked about our asymptomatic testing program going out into assisted living facilities. We identified 2 clusters, one being at one facility which had a severe cluster. Happy to report that we reached out to Upstate, with the thought process. We identified these individuals that are asymptomatic. Some of them will become very sick. Some of them are in situations where they can't afford to get very sick. What can we do? So we teamed Upstate up with our partners at these facilities, and today and tomorrow, the eligible residents will be receiving the monoclonal antibodies, so that they'll get the antibodies directly in their facility, so that hopefully that prevents them getting sick and needing to go to the hospital. So as we proactively hunt the virus in these facilities, that's what we're going to do. We're going to work with our partners when we identify a resident who qualifies for these antibodies. I think the president got these antibodies. Then we'll try to get the antibodies to the resident so that way they don't ever get very sick. But really a nice success story for these 4 people that certainly would not have happened if we didn't have our community-based testing program going on. Questions?
So these aren't people that have coronavirus yet, but they're likely exposed within their residential community, and because they are arguably the most at risk for becoming severely ill, this is a proactive.
So Andrew, they actually do have COVID, they're just asymptomatic. And so these are, we had a facility last week, I think we tested 90 residents, 27 of them had COVID. We knew about the antibodies, we knew that certain classes of individuals qualify, so we then talked to Upstate about, Upstate has these. They like, if you have these pre-existing conditions, one way to avoid going to the hospital is to have this done quickly. Usually you have to go there and do an IV treatment. So we talked about and we partnered Upstate with the medical teams at the facility, identified through the residents who would qualify, and those that qualified and consented, of course, are getting the treatment. So we're very proud of that.
For the vaccine that you were speaking about, the plans and everything, are you hoping that if you get the how plan to the state, we might get vaccines earlier? Or
yeah, I don't think, you know what, so this is, I think how we're getting it, you've heard the governor say you want to be the first state to get everybody vaccinated, time to market, advantage maybe for economic growth, right? So we would love to be the first region, right? And we think logistically we have the facilities, we have the people, we have the plan. So what's happening now is the first phase is the easiest phase. You can go through the kinks, right? Hospital workers, so the hospitals administering the vaccine. That's not a sustainable model because the hospitals need to treat the COVID patients, and the hospitals need to treat people who have a heart attack and everything else. So the counties are the ones who've built up this infrastructure. This is what we do. So we have a plan. We've taken, looked at the model the state has come up with. We've put forward requests on how we can help implement all this fast and done and put our resources at it. We've built up all these employees. I call back furloughed employees. I've brought on 103 employees, all to get this done and get this done fast. And if you get it done fast and you go through your vaccine, you have a better case to get more, to your point. If you have 6,000 vaccines for this class and you got 6,500 people in that class, and you only get 6,000, if it takes you 2 or 3 weeks to get the 6,000 people done, you have no, you have to wait for the rest of it. So I don't think it's a first come, first served situation, but you can't get behind the other regions. And so how do you do it as quickly and efficiently as possible? We know how, because we have the plan. We tested the plan every year. So we've shared the plan. Yes. Honest answer, yes. I don't know that. I think I know that, but because we are, I like the chain of custody with the hospital having it. right? So I like that the state's saying this is the who, this is who's going to get it, right? I like that. I like the chain of custody, so you know one, maybe two entities that have it, and then can transport it securely to the spot where the operation works. The operational point of this, we're the only ones suited in this region to do it, outside of people coming in. So we're happy to be part of any team doing that. But when we have the emergency management department, we have the health department, we work with our poor, we work with our elderly, and not many other employers have 3,000 employees they can throw at this to get it done. We do.
Christmas is only 2 days away. I know that you've talked a little bit about your guidance and in the bubbles and everything. The CDC is saying that if you're in your home, that's the people that you need to stay with. Do you agree with that guidance? I mean, what is your...
Yeah, I'm never going to disagree with what the doctors and the scientists say. I think from a practicality standpoint, for some of us, our bubbles in this process have been a little bit larger than your own household. And from a practicality standpoint, if you've been seeing the same group of people every week, when you go to work, you come home, there's the same group of people, that's your bubble, your pod. I don't think it's practical. It's recommended, right, to stay within your own household. I don't think that's practical. So what we said is stay within your own pod then. What you don't want is people coming in that you haven't had contact with, traveling, et cetera, and that just brings more risk. But the CDC is right. If you're looking to eliminate the most risk, then just celebrate with your own household. What we've said is we understand just from what we see every day that there's a practicality of this. So if in your pod is your aunt and uncle, then if you're going to be more than your household, keep it within your own pod.
If somebody wants to get tested who's asymptomatic before Christmas, there isn't much options. Like you said, there's been a lot of testing done, but it doesn't seem like...
There's a lot of options. It's just in such demand there is no more options, right? So we put the schedule out. Again, you're probably looking at, from our standpoint, I don't know, could we hit 10,000 tests in 4 days, Dan, you think? 10,000 tests in 4 days, maybe? Close. Probably close to it, that we put out to the public. It's so busy because of people thinking the way you're thinking, Tom. But there's only so much capacity. You know, we can't test 40,000 people in 4 days. We don't have the capacity to do it. So if you're trying to get a test on Wednesday before the Friday event now, it's probably tough to do.
Do you know how many people from outside Onondaga County are coming into the county?
We do track that, and I'd say 10%, 15%, probably from the region. And again, that doesn't bother me. At one point, we looked at it, saying, you know, do you want to just limit it to county residents? If these are folks from your surrounding counties, there are partners in this. If Cayuga County's on fire, or Madison County's on fire, or Oswego, to think that fire won't spread to our county is it's just small thinking. So we want to help our partners around us as a region. We've been a team this whole process in the pandemic, and we'll get through this as a team.
Throughout the pandemic, News Channel 9 has consistently gotten emails about stores not enforcing mask wearing. Specifically, the most frequent complaint seems to be about Wegmans, and I imagine it's because people shop there the most often. Wegmans' policy flat out says they will not refuse entrance to someone. They'll do a lot of proactive steps, but if that person ultimately refuses, that person's still allowed to shop. I'm wondering your thoughts on that policy.
Yeah, I think they should look at the policy differently. And I talked to the DA about this last night. I think there was an incident, potentially. I didn't see the incident, but we've gotten the complaints, Andrew. We've reached out. When we get the complaints, we call them all the time, and we send investigators there. So they need to rethink the policy. And certainly the DA and I were talking about various things, and we might have more things to talk to the public about on this topic moving forward. So businesses need to be part of the solution, especially considering how many small businesses have limitations on their capacity, if not being shut down for actions that they didn't do. Your bigger stores, your corporate stores that we need to have open for obvious reasons need to be part of the solution and need to reassess the policies that are contrary to the public health needs.
And I think, you know, people have criticized our attention to this issue, saying, why are you picking on Wegmans? Is there a higher expectation when the corporate headquarters is down the thruway, not in Bentonville, Arkansas, like Walmart,
Yeah.
but a place people go, a place people love, and a place where the owners live around us?
Yeah, we're very proud that Wegmans is kind of an upstate New York company, right? When you go, if you're traveling out of state, Andrew, right? If you go to Virginia and you see a Wegmans, you get a smile on your face. You want to go shop there, check it out compared to your local Wegmans. So, I think to that degree, I didn't know that was really their policy. Their policy needs to change, and so I love Wegmans, and so. Now, the store I go to, I don't see that. Maybe that's because they know that me and the mayor go to the same Wegmans, and they're scared that we're going to be hunting them down each aisle. But the other stores, I know there's been problems.
One last question on this topic. I get the county's list of places that have been served warnings and fines. There's only a warning listed for one Wegmans location. That warning was appealed, no fines. I'm wondering, what else could people do when they're in that situation to get the county the information for you to take more action?
Yeah, a lot of it's a complaint-driven process. So if, for us, you get the complaints, you need some level of evidence, right? So when we have evidence, our investigators go out, and if they go out and there's nothing they see, even though there was a complaint there, we're not saying that someone wasn't wearing a mask or an employee wasn't following the rules. We just didn't see it. So then it goes on. So that's what it is. There's not resources to proactively drive to every business looking for this. There never has been. It's got to be a complaint-driven process. And if we have evidence, we don't even need to, we can just go and fine. If we don't have evidence, we have to go and witness it ourselves. Yeah, well, with parties, nobody, again, I think at every level of government, people acknowledge you're not going to go knocking on people's doors in their homes, right? Everybody acknowledges that. The best way to celebrate ending this year is to not celebrate. Okay, so everybody wants to celebrate ending 2020 and going to 21, but don't celebrate it with other people. That's the best way to do it. I'm more concerned about Christmas coming up than I am New Year's. A lot of your traditional establishments that you might go out for drinks or something, they're not open. So I think Christmas is the big hurdle. And if you look at it, look at our data. Tomorrow is always our high day, right? So I anticipate we're going to have a lot of cases tomorrow. I don't know what the number is yet, but that's just the way tomorrow works. But we're on pace to have our second week in a row of less cases than the week before. And so we haven't been here since probably August or September. So even though the cases are still too high, we're coming down. So what can change that? People get too comfortable, or people go, or you have events, right? So we got, to your point, two very big events in front of us. I just think people have to have learned from Thanksgiving and what's been happening here. This is going to be the deadliest month of the pandemic in December. It's just been brutal. So if people don't get it, and many of the people, so out of the folks, the 4 nursing home deaths, we know where they are. The other folks, some of these folks come from facilities, senior facilities, and they die in a hospital, but I think 3 out of the 4 didn't. So these are people that lived in neighborhoods, got sick with COVID, went to the hospital and died. So everybody should understand that we're still in a fight here. We're making progress. We got the vaccine going at the same time. But what we've all been doing over the last 2-3 weeks since Thanksgiving has been working in our favor. The data shows it.
Coach Boeheim said on the radio yesterday that his players are able to practice on their own at the Mello Center while under quarantine. Is that your understanding as well, that while under quarantine, these players can go to a somewhat public facility to work out?
Correct. Yeah, so it's essentially not open to the public. So the athlete under quarantine is allowed exercise each day, and so that they can go and work out each day.
Is that a dangerous precedent to let people out of quarantine to go to a gym? Would you let a non-basketball player go to the Planet Fitness around the corner?
Yeah, I think it's an interesting question, Andrew. I think there's guidance on this topic for a reason. From a practicality standpoint, these are athletes during a season. These athletes are still being tested 3 times a week. Right now, the state is yet to adopt the CDC standards for a quarantine, which would put some of these athletes probably out of a quarantine in a matter of days. So I think when people look at the guidance and they look at the rules, they factored some of this in. So again, I understand the point. Somebody in a quarantine, do they get to come out of their house? You do on your property, and you get to walk around your property. These are student athletes that this is their home, and essentially that building is their home for most of the time during the season.
That guidance comes from where? The State Health Department? Or
Yeah,
the
I'm
ACC?
pretty sure that, no, not the ACC, but State DOH. Yeah.
Ryan, can you speak a little bit more about the last couple of days? We've had 2 days in a row now where the new case numbers are below 300. What should we take from that? But you said that tomorrow may be a higher day.
Yeah, so usually Thursdays are our high day. I think whether it's it all gets dropped on us from the systems they work or the labs. So we've had really high days every Thursday for the last month. So I'm going to anticipate a high day tomorrow. So on Thursdays I always have a high day. It's what did you do every other day. And usually the Friday is always a little bit higher than the Saturday. Then it starts to slow down. So what we're looking to see is that are we still seeing overall decreases in caseloads? The positivity rate has dropped. Part of that is we're identifying it more. You're doing some more testing, but we're also isolating it faster. So we're isolating the risk faster to the community. But we're making progress. It's just we're still in the most important week of the pandemic when it comes to does this get back up over to 7%? If we have another 1 or 2 weeks of sustained cases in the 400 range, the death number is not going to go away. It's just more people getting it, more people getting very sick, and then more people dying. So I think if we can continue on this trajectory, our hospital numbers will continue to decline, and more people will survive this, and it gives us more time with the vaccinations.
And another topic, SU is starting to release some of the information about what they're planning for spring semester, and they have really ramped up their testing capacity. As you look ahead, do you think it's practicable for students to come back at the end of January?
Yeah, so I talked to the chancellor about this, and I think right now you always, if we were to see a spike, we would see it between January 9th and the 16th from the holidays. And so I believe the plan is the 30th or somewhere around there. You would remember these students coming back in have to test negative, so they're coming in with a clean slate. But you really got to see, the chancellor and I talked about what the data looks like following that. Are we in a place where we're still in the same range, maybe a small little hit, but if you see huge spikes, certainly that potentially could delay things. We got to put things in perspective, Terry, from the standpoint, and I know this is hard because we're seeing elevated caseloads, but if you watch the governor's briefings, I think today we're the 3rd best state positivity rate. The positivity rate of the state's not much lower than where we are, right? So you can't if you have your capacity in the hospitals and you're continuing to do what you're doing, you still got to live and learn how, and keep going forward. So what we know about these young people is even when they get positive, for the most part, they tend not to get as sick as other demographics, and having that much testing in the community is a benefit with what their testing plan is. It's really aggressive. It's very good. So we'll see. If we don't get a spike from the holidays, I think they probably start up the semester on time. If you get a spike and it doesn't start to slow down, maybe there's a delay. Mm-hmm. Yeah. So there's 30 folks ready to go in Onondaga County there. Staffing, again, getting staffed up for that. So we expect the transition. Today's kind of a tough week to do the transition with, when you look at, if you just think logistically about people's personal holiday schedules where you work, covering regular shift times. This is a little harder when you're bringing a new one online. But we anticipate that the facility will be busy and active next week.
Just one more question about the vaccine. Who is monitoring upstate to make sure that it's frontline workers that are getting the vaccine? That would be the state.
State. Yeah. So the state, again, the state's a regulator in the space anyways. So State Department of Health, and then the state's determining who, and the state's determine the regional hub plan, and they'll determine any differentiating plan again out of what they've already put forward. The first few phases are challenging, but they're the easiest phases we'll have. It gets really tricky when you say all educators or people over 74 and this and that. You're talking about thousands and thousands of people that will be very anxious. So how do you do all that? That's where our planning, we've already done it. So our message is, let's not recreate the wheel. Let's continue this great partnership we've had throughout the pandemic. Yeah, and I think that's kind of where, when you look at the health directors and our health commissioner, Dr. Gupta, that's where she comes in, oversees that kind of point of distribution process. And again, very competent. These aren't, we get federal funding every year through the state to do this. And we do runs. Even if you don't have a pandemic that year, vaccination, you do vaccination runs, so to test the plans. So we're ready.
Do you have an estimate for how many vaccines have been given out in Onondaga County so far?
I really don't, Terry. I think right now, just if I was going to do some quick math, I would say we're probably over 4,000 right now, but I really don't. We're trying to get a handle on, out of the long-term care facilities, how many they've done. I know Kraus and Joe's and Upstate have essentially done a lot of their team as well. But that would be, that's an estimate. We're trying to get a handle on that ourselves.
In coming days, do you think you'll be able to add that to the dashboard?
I would love to, yeah. I very much want to know that each day. And so, again, part of that challenge is, right now, this is a new process. It hasn't been centralized yet, efficiently yet. So once that happens, I think we'll be able to talk about what's happening in real time.
What are you doing for Christmas?
I'm going to be at my house. Same thing. Thanksgiving, I was in a quarantine, Terry. You didn't stop by. But it was, I'll be at my house. Christmas morning's always a lot of energy in the McMahon household. So I'm sure Santa's going to come for the 3 kids. I don't know about the dad, though.
Do you have a briefing schedule for next week?
Yeah, I think next week, we'll do our regular schedule, Monday and Thursday.
And what is on Andrew McMahon's Christmas?
So Andrew, he, as you know, he loves his law enforcement and emergency management departments. So I'm sure Santa's acknowledged this and recognized this. So he asked for a lot of different things related to that. He watched a Western movie the other day, so now he's interested in cowboys as well. So Maddie's very interested in Harry Potter, and Jack was very hard to shop for this year. Anything else? Well, folks, hopefully you'll have a very safe holiday season overall. Again, happy Hanukkah to all of our friends, and Merry Christmas, and soon to be Happy Kwanzaa as well. So please be safe with your families and enjoy the time with each other. Thank you.